It was around May, June in 2020, and it was lockdown time. And I started to get a very unusual symptom that I'd never experienced before, but I was otherwise healthy and active. Because it was lockdown, I wasn't attending the gym, but I was compensating for that by doing a lot of walking at our holiday house. It's on a hill, so I was doing a lot of a lot of exertion. So I was feeling fine, other than this particular symptom that was waking me up at night, and I thought I'd better check it out. It was essentially a squeezing in my upper right arm, and I've described it to other people as rather like having a blood pressure cuff inside my arm. That was the sensation of a squeeze inside the arm. And it was sufficiently strong to wake me up at night. And I thought, there's something wrong there. I knew it wasn't muscular. So I went to a GP. I was actually in the process of changing GPs at that time, and had a series of tests. And the thing that was most important in those tests was the blood test, which showed low hemoglobin. And from there, I was referred to a hematologist, and my diagnosis was eventually established. I've got light chain multiple myeloma. So it was interesting. I was given that diagnosis in a telehealth session, and it was quite shocking, because again, when you enjoy good health, you never really expect to get these sorts of diagnoses or responses from tests. So it was quite a difficult thing to assimilate and come to terms with, because it just came out of the blue. I was someone who was otherwise healthy and fit. I was on no medication, and then I've got this diagnosis of a disease that's not curable, certainly treatable, but so it was quite a big event for me, obviously. I'd done the standard induction treatment for multiple myeloma, sort of ahead of having a stem cell transplant. And my response to the induction treatment was not particularly good. I think it was just sufficient to qualify for the stem cell transplant. But I was unable to collect the stem cells at the first attempt. And as far as I understand it, Hang was very concerned about my remaining off treatment if I waited to have another attempt with a stronger stimulant. So, because my light chains were going up. So she was, I think, hesitant to sort of have me have another go for the stem cell transplant and the collection of stem cells. And it was at about that time that she told me I have a mutation. And I think from my reading, about 15% of myeloma patients have this mutation. It's a translocation of chromosomes called T1114. And Hang explained to me that patients with this translocation respond remarkably well to a drug called venetoclax, which was available on a clinical trial. And fortunately, I met the criteria for participating in the trial and went onto it pretty well straight away. In the context of my situation, probably not, largely because I'd been very disappointed and obviously anxious about my response to the induction, and then not being able to collect the stem cells. So this presented as an opportunity. Although, having said that, there's always, the very use of the word trial has connotations of experimentation and all the rest of it. So I guess there's always a little, some anxiety about going on to a trial, and then the documents you sign, have to list all of the possible consequences and side effects. And of course, they have to include absolutely everything. And that's always a bit scary. But in general, I'd say, no, I wasn't too concerned because I saw it as an opportunity rather than something, you know, very scary and experimental. On this trial, I take daily oral medication. I take 800 milligrams of venetoclax every day, and I record that, the amount and the time, on a participant diary. Every 28 days, I also attend St Vincent's Cancer Centre and I have a subcutaneous injection of daratumumab. And I'm also on a weekly dose of dexamethasone. So it's really quite simple. It's mostly oral and some minimal recording in a diary and presenting every 4 weeks at St V's. As far as I know, years plural. Hang uses the plural of years, so I'm not entirely sure what the span of AbbVie. AbbVie is the drug company. I don't know precisely when it would finish, but I know that it's, you know, it's years plural. I feel fine. I actually feel normal. I feel well and I feel normal. And you know, it's been pretty much like this since I started on the trial. I've had a few minor issues with side effects of the drugs, but nothing major. And right now, yes, I feel good. Look, it's probably going to be embarrassing for me to say this about Hang, but I just want to say how fantastic she is. She's not only a medical guru, but she's empathetic and a wonderful communicator. And I feel very, very fortunate to be in her care.